When doing fusions on patients, we do use instrumentation, which are screws, and these screws have to be placed accurately within the spine. There's different ways of doing this. One way would be using X-ray machines and doing it by hand. The downside of doing this is there's radiation, it takes longer, and it's not as accurately placed into the spine.
With the Mazor Robotics, you have really some computer software that allows you to plan out your screws and plan out your surgery, well in advance, which makes for a better surgery and also usually makes for a faster surgery, which always benefits the patient.
We can preoperatively plan exactly the size, including the length and the diameter of the screw, the exact trajectory that the screw needs to follow to place it within safe structures and avoid things that could be injured. So it really makes it a safe way to put in hardware.
With the Mazor, we're able to do this more accurate. We're taking 2 X-rays versus using fluoroscopic imaging. This allows us to get the screws within the spine and be millimeters of accuracy. So it allows us to place these instrumentation and screws in the patient's spine in a quicker and a more accurate format.
We see the terms, laser surgery, minimally invasive surgery, all those just mean smaller incisions, less pain for the patient, usually getting out of the hospital faster. Mazor Robotics is definitely helping because we can place screws accurately through small incisions and get the patient home and back to doing their normal activity in a quicker and faster.
If the case is appropriate for a minimally invasive type technique, then we can use the Mazor robot to minimally disrupt the tissues so patients can get over it a whole lot faster. They can go home from the hospital a whole lot sooner. It still takes the same amount of time to fuse, but the recovery is a whole lot easier.